Hello, everybody. Thank you for sitting in. It's great to see you, even though I can't really see you, but it's nice to have you with me for this hour. I think this is a very important and timely webinar, this particular topic, and I think you're going to get a lot out of it, actually. So why don't we begin? Nutritional medicine and liver detoxification and health. As I promised you in the promotion of this webinar, we're seeing, of course, an escalation in environmental toxins and xenobiotics, a lot of people taking a lot of different medications. There's an unbelievable escalation in non-alcoholic steatohepatitis, which is fatty liver degeneration, now affecting 25% of the world's population. And as the liver gets taxed more and more by all these different things, it relies on a lot of nutrients in order to be able to protect itself and to detoxify end products of metabolism and xenobiotics and all these things we're talking about. So this, if the liver finds itself in a state where it doesn't have optimal nutritional support, then it leads to more impurities floating around in the bloodstream that can damage the tissues. It also can cause an insult to the liver itself, as you're going to see. So since the end of World War II, there's been more than 80,000 different chemicals created by chemical and biochemical industry. And, it's really just everywhere. So the human body has never been exposed to so many different foreign compounds. And so there's a lot of stress on the liver every day of our lives to try to deal with these things and convert them into non-harmful substances that can be excreted from the body in a timely fashion. So that's what we're going to look at today. So it's really the intestinal epithelial cells and the liver cells that do really the heavy lifting when it comes to detoxification. And the way that they deal with different compounds that they want to detoxify is through a series of phase 1 and phase 2 detoxification enzymes. The phase 1 detoxification enzymes are called the P450 cytochrome mixed function oxidase. There's about 50 to 100 different types of enzymes, and sometimes their functions overlap, as you'll see. But often when phase 1 detoxification encounters a compound and it sort of converts it into an intermediate compound, often the intermediate compound is a free radical. It's actually more dangerous than what the original compound was that it was dealing with. And so in a timely fashion, it has to sort of hand that compound to the phase 2 conjugating enzymes, where the intermediate is either quenched by an antioxidant or it is attached to a conjugating agent that will stabilize it, make it more water soluble and easier to eliminate, and convert it into a very non-harmful biologically inactive compound that can be eliminated in either the urine or the feces, as you'll see. So there's 3 situations where impurities and toxic compounds can accumulate in the body and overwhelm our systems and maybe possibly lead to cancer risk as well. So this involves faulty detoxification. That's what our focus is going to be on today. How do you optimize that? But also intestinal dysbiosis. A lot of unfriendly bacteria can release endotoxins that will be absorbed into the bloodstream. And leaky gut syndrome, with the intestinal tract wall is compromised and partially digested food enters the bloodstream and other compounds. It can also produce immune inflammatory responses that can make your health deteriorate. So we'll deal in the next webinar that I teach with intestinal dysbiosis and leaky gut syndrome, but today I want to focus just on liver detoxification. So the way that it works is that 2 quarts of blood go through your liver every minute of your life, and a lot of the purpose of that is to actually sort of cleanse the blood, if you will, put through this sort of filtration plant. So 75% of the body's detoxification occurs in the liver cells themselves in this 2-step manner of phase 1 and phase 2 detoxification, working together sort of hand in glove. So, I think pictures of this really help to tell the story better than anything. So you can see that in phase 1 detoxification, there are nutrients that are required to help optimize the function of the P450 cytochrome oxidase system. Different B vitamins, glutathione, various antioxidants are going to quench some of those free radical intermediates. And from milk thistle, there's a very important flavonoid called silymarin. We're going to talk about that. Carotenes, you know, like beta carotene, lycopene, and vitamin E and vitamin C. So then in step 2 detoxification, the intermediates that are formed are conjugated, they're attached often to amino acids, well, like taurine and methionine. We'll see these. Also, you'll notice that as we go down this list of amino acids, but you also see these sulforaphanes, and also other aspects of cruciferous vegetables like the indole-3 carbanols, also garlic and onions, the allium compounds, the sulfur-containing compounds in these foods can be helpful in stage 2 detoxification. So ultimately, you convert these into waste products that are water soluble and non-biologically active. The liver cell can release it into the bloodstream. It'll get filtered by the kidneys and you urinate it out of the body, or it gets secreted into the biliary tract and in your bile, and then it leaves as part of a bowel movement from the body in this inactive form. So here's another way of looking at it that's a bit more simplified. Here's the phase 1 detoxification enzymes doing different types of reactions: oxidation, reduction, hydrolysis, hydration, reactions you're familiar with, supported by a lot of common nutrients that we talk about all the time. Then the phase 2 conjugation pathways. Well, we're going to look at all of these in some detail: sulfation, glucuronidation, glutathione conjugation, acetylation, amino acid conjugation, and methylation. And some of the main players, nutrients that you need to support those systems, you can see here: a lot of B vitamins and vitamin C, and the amino acids, cysteine and methionine, taurine, glutamine, folic acid, and choline, because from choline you can make trimethylglycine. This will all come together in a nice little story as we go forward. This is the more complicated version of it, but I think it's worth spending a few minutes here. You see at the top, these are endotoxins from when you have dysbiosis or a lot of unfriendly gut bacteria. They produce toxins that leak into the bloodstream. They have to be detoxified by the liver. Then there's all these exogenous compounds coming in from the body. Drugs, like prescription drugs, over-the-counter drugs, recreational drugs. And you also have chemicals used in agriculture, food additives, household compounds, pollutants, contaminants. All these things are entering the bloodstream. There's no way really to avoid all of them. And so they need to be detoxified in a timely fashion. So here's the phase 1 detoxification enzymes we talked about, doing oxidation, reduction, hydrolysis, and so on. And the cofactors that are necessary for these reactions to occur: B vitamins, glutathione, branched chain amino acids, flavonoids like silymarin, but also flavonoids like quercetin that you get from common foods, and some phospholipids. And then some of those intermediates become free radicals that need to be quenched by carotenes, vitamin C, vitamin E. Remember that selenium and copper and zinc and manganese are the prosthetic group for certain antioxidant enzymes that the body makes, like catalase and superoxide dismutase and glutathione peroxidase in the case of selenium. CoQ10 also acts as an antioxidant here, as well as the thiol groups from garlic and onions and cruciferous vegetables. Here's silymarin again from milk thistle, pycnogenol, another type of flavonoid. And then in phase 2 conjugation reactions, here's where you attach that intermediate to often an amino acid like glycine, taurine, glutamine, ornithine, arginine, or it gets sulfated, or you go through glucuronidation attached to glutathione. Notice that glutathione is in both phase 1 and phase 2 detoxification. That's an important consideration. Ultimately, the liver has the capacity to convert these things into very non-threatening agents and eliminate it from the body so they don't do harm to the liver or to other cells if they escape the detoxification process and they circulate. What damage do they do to reproductive organ tissues, to other cells in the body where it might cause mutagenic changes? So faulty detoxification is what we want to be looking at so we can correct it. But before we get to that, Also understand that the liver has these Kupffer cells, which really are monocytes that became a macrophages, but in the liver, they're called Kupffer cells. And they kill 99% of the bacteria that enter the bloodstream from the gut. So when you have food, there's a lot of bacteria in food, and it gets absorbed into the bloodstream. In the first place, it goes is to the liver, and these Kupffer cells kill a lot of the bacteria in contact. And it's a good thing that that happens. We would be much more prone to foodborne illnesses if we didn't have these Kupffer cells working hard for us. But in terms of detoxification, phase 1 and phase 2 enzymes can be affected by the aging process. As we get older, the detoxification enzymes slow down. That's why people who are older, they adjust their medication to lower doses because they don't metabolize it as fast as when they were younger. Certain medications can damage the detoxification centers, or they can sort of compete for detoxification with those enzymes, and so other things don't get detoxified in a timely fashion because the medication is being detoxified by that particular enzyme pathway. Alcohol plays a very big effect on damaging liver enzymes, as you know. We're going to look at dietary practices, the role of nutritional supplements, and people that have existing liver disease, whether it's hepatitis or alcoholic cirrhosis, damage from using statin drugs or other drugs, even damage to the intestinal lining, where a lot of things are leaking through and getting to the liver, slowly over time can decrease the efficiency of phase 1 and phase 2 detoxification. A shift towards more sluggish detoxification permits various toxins and xenobiotics to accumulate in the body, which may cause other health problems and even aggravate skin and complexion problems. We've seen some evidence where people with eczema, the odd person with psoriasis, see improvement, and when you enhance their liver detoxification function the way I'm going to show you. Studies show that providing nutrition supplementation support for liver detox can improve various health parameters and actually support the liver, maybe improve liver enzyme function as well, which you see on a lab panel as the liver enzymes start to drop when they were previously rising. So there's certain things that can enhance phase 1 detoxification. These are sort of nutritional modulators, if you will. Eating more cruciferous vegetables because of the indole-3 carbinol. Vitamin C, eating oranges and tangerines that have limonene, this flavonoid supports it. If you're taking a supplement that contains milk thistle, the silymarin is helping. St. John's wort, people use it for depression. It speeds up detoxification, but also speeds up detoxification of drugs and messes up the person's prescription. So I'm not a big fan, really, of using that when a person is on a medication. There are factors that can inhibit detoxification of phase 1. Eating grapefruit or grapefruit juice that has neurangenine, which can inhibit detoxification by 30%. So the major drug-nutrient interactions, if a person's on any kind of medication, I usually caution them about having grapefruit or drinking grapefruit juice. Antidepressant drugs can also inhibit these modulators, so can antihistamines, and bacterial toxins leaking in from the gut can do the same thing. This is why I think probiotics and prebiotics and eating fermented foods that have probiotics is a very good thing to do on a regular basis. We'll talk more about that in the next webinar. But the aging process slows these processes down. So certainly by age 50, you need to be paying extra attention to how liver detoxification is working. Some of the references on that. Then in phase 2 detoxification, it primarily involves 6 conjugating reactions, whereby phase 1 intermediates are attached with the help of phase 2 enzymes to either amino acids or glutathione or sulfur-containing compounds, or they react with the methyl or hydroxyl groups in order to neutralize them so they can be easily eliminated from the body. So we're going to look at these detoxification pathways. So in total, this is what they look like. There's the glutathione pathway, different amino acids, methylation, acetylation, sulfation, sulfoxidation, and glucuronidation. Let's start with glutathione. So in glutathione conjugation, remember the body makes glutathione from glycine, glutamic acid, and cysteine. But cysteine is the rate limiting step. The body has a hard time getting cysteine. It can make cysteine in the presence of vitamin B6, as we will see. But giving people certain glutathione supporting nutrients to raise glutathione is something that you can do in special situations, as we'll talk about. But the depletion of liver glutathione stores by various chemicals, acetaminophen is a big one, right? The use of drugs like Tylenol, or in liver infection, where we see that there's a decrease in liver glutathione. You start having a rapid progression to more serious liver disease and increasing toxicity. In fact, the life-saving antidote for someone with acetaminophen poisoning is to get to the hospital, they give them an IV of N-acetylcysteine, because N-acetylcysteine raises glutathione in the liver and prevents liver failure in the person from dying from the overdose of acetaminophen. So we'll talk more about that shortly. So we know that you can raise glutathione levels in a number of ways. One way to think about this is that if in your liver cells, if vitamin C and vitamin E are doing a lot, and selenium attached to glutathione peroxidase, they're doing a lot of the work to quench free radicals, it frees the glutathione up to participate more in detoxification reactions. So you can raise your glutathione levels simply by putting in more vitamin C, vitamin E, and selenium. So if you're taking the Adeeva multivitamin that has 1,000 milligrams of C and 400 IUs of E and 200 micrograms of selenium, it already is supporting glutathione levels, because these antioxidants are quenching a lot of the free radicals in liver cells so that the body can use its glutathione for detoxification purposes. If you need to raise glutathione beyond that, which I think people over the age of 50 should consider doing, or people with any existing types of certain types of liver conditions, or if they're on acetaminophen or polypharmacy, then you can take supplement with N-acetylcysteine, alpha-lipoic acid, L-glutamine, and silymarin from milk thistle. I put those four things together in a product called Ultimate GLX, which I will show you later. But glutathione plays a really important role in quenching a lot of intermediates, converting them into non-toxic water-soluble compounds that the body can easily eliminate. In terms of amino acid conjugation, a lot of that is done with glycine, taurine, glutamine, arginine, and ornithine. With respect to methylation reactions, and we'll come back to some of these, you need to have the methyl group. The CH3 group has to be there from acetylmethionine. Well, that requires folic acid and vitamin B12. This is a very important pathway for getting rid of a lot of environmental toxins, a lot of these xenobiotics that are coming in as sort of man-made chemicals. So just to remind you of how you make these methylated acetylmethionine. Here's folic acid entering the body. It goes through a series of steps down to 5-methylfolate. Along the way, it picks up the methyl group from serine or glycine. It hands it to vitamin B12 to convert homocysteine to methionine. From there, you can make acetylmethionine. And when you have acetylmethionine, the methyl group that's attached to acetylmethionine, or SAMe, participates in these detoxification reactions. So you need folic acid and B12 at optimal levels in order to make that happen routinely, like every minute of your life. And you'll notice also, if you look at that same cycle, here's methionine being recycled to homocysteine. And so the folic acid and B12 work. Here's your acetylmethionine, very important in the detoxification reactions for xenobiotics and detoxifying steroids and other metabolites. But also from homocysteine, using vitamin B6, you get to cysteine. You need the cysteine to make glutathione, which is important for glutathione conjugation. And once you have cysteine, using B6 again, you can go down and form these enzymes that are necessary for sulfation, which get rid of a lot of xenobiotics as well and other steroid drugs, and help to metabolize even vitamins that you put into your body in a timely fashion. So to keep this whole cycle going, these methylation sulfation reactions, you need every day the right amount of folic acid, B12, and vitamin B6, which, doctors just often don't clue into this. Then there's acetylation reactions. For acetylation reactions, you need a pantothenic acid, a B vitamin, vitamin B1, vitamin B2, and vitamin C. 50% of Caucasians are known to be slow acetylators because they have genetic polymorphism of these enzymes, which increases the damage from cigarette smoke and asbestos exposure from lingering. It lingers in the body longer, puts them at a higher risk. So higher intakes of B vitamins and vitamin C can help these enzymes work a little bit better. In terms of sulfation, the sulfur groups from sulfur-containing amino acids like methionine and cysteine and taurine are really critical. So remember that to make cysteine, you need vitamin B6. To make taurine, you also need vitamin B6. So this pathway increases the solubility of toxins for easier excretion from the body. It's essential for the elimination of sulfa drugs and sulfa compounds like food additives and also bacterial toxins, steroid drugs, neurotransmitters, thyroid hormone that needs to be detoxified at some point, all going through these sort of sulfation reactions. And then there's sulfoxidation. So these enzymes, the sulfate oxidase metabolizes sulfites into safer sulfates, which can be excreted in the urine. But for that enzyme to work, you need the mineral molybdenum. So if you look at the Adëeva multiple vitamin, you notice that I put molybdenum in there. And the reason it's in there is to support this enzyme system, this detoxification system. It helps to detoxify some sulfur-containing agents found in garlic, sulfa compounds at salad bars that are in some of the preservatives. Some people who have an intolerance to garlic and sulfur-containing compounds, often this enzyme is slightly defective. Molybdenum can sometimes help to improve their ability to tolerate those compounds. Then there's glucuronidation. About 5 to 7% of the population has a condition called Gilbert syndrome, where they just very slowly have this pathway working, again because it's due to polymorphism. So if these subjects ingest alcohol or vanilla or benzoates or aspirin or some hormones, very often the sclera of the eye starts to turn yellow because bilirubin is building up in the system, and on blood tests you see higher bilirubin levels. The only thing that's been known to help support this pathway is the ingestion of the flavonoid limonene that comes from oranges and tangerines. That may help to mitigate some of this. In general, these are nutrients that help to support detoxification. Vitamin C, B50 complex, vitamin E, molybdenum, indole-3 carbinol, milk thistle, soy products, N-acetylcysteine. And I happen to like N-acetylcysteine with alpha-lipoic acid, L-glutamine, and silymarin to really raise glutathione levels. So let's drill down on some of this. With respect to milk thistle, it contains this flavonoid called silymarin, which has been shown to regenerate damaged liver cells, provides antioxidant protection from drugs and alcohol and xenobiotics. It supports liver glutathione stores, has been used to repair some liver damage induced by hepatitis, cirrhosis, and other types of drug damage. Milk thistle has been shown to be effective in a small number of cases of psoriasis due to its ability to eliminate certain compounds from the bloodstream. Sometimes you have these compounds in the bloodstream and the immune system reacts to it. You get immune inflammatory responses that upregulates the sort of autoimmune behavior of immune cells in the skin, so the condition gets worse. So if you can clear those things out, sometimes skin complexion problems improve, including the odd case of psoriasis. There's other factors in psoriasis. This is not the only nutritional medicine factor of importance. Soy products play also a role in upregulating phase 2 detoxification, really helping to detoxify estrogen and a lot of sort of the xenoestrogens that are produced, these sort of estrogen mimickers that are out in the environment that we're more exposed to. We'll talk a little bit more about that. Then there's N-acetylcysteine that was used originally, to help people that have HIV to maintain their CD4 cell function to help slow down the conversion of HIV to AIDS. But if we go back to milk thistle for a moment, it contains this flavonoid called silymarin. So if you're going to use milk thistle, you want to use a standardized grade of milk thistle that's 80% silymarin content. It helps to increase glutathione, it repairs some liver damage, it helps to prevent some liver damage in people that are taking certain drugs. Even if they have to take the drugs, they're prescribed over the counter, whatever it is, you need to protect your liver to a greater degree, also from alcohol or hepatitis C infection. It really does a great job of boosting phase 2 detoxification. And it provides also antioxidant protection as well. So it's an incredible nutrient. So this flavonoid silymarin has been purported to boost liver glutathione, as I said, enhance liver's overall ability to perform detoxification reactions. There was a great summary a few years ago where they said Evidence exists that milk thistles may be hepatoprotective through a number of mechanisms: antioxidant, toxin blockade at the membrane level, enhanced protein synthesis, antifibrotic, and possible anti-inflammatory, also has immune modulating effects. It's an incredible little natural agent that doesn't get enough airtime in my view. Here's an incredible story of this guy, Dr. Todd Mitchell, MD in California, who became aware of a family that went out sort of on a little wilderness trip, and they confused the death cap mushroom with a mushroom that was safe to eat, so they ate it. And then they realized after they ate the mushroom that it was going to cause acute liver failure within a number of hours, and they would all be dead. So they contacted this MD, and the MD got permission from higher medical authorities to use milk thistle to see if it would help save their lives. And he saved the lives of all 6 of the family members except for the 83-year-old grandmother. So that was written up in 2017. But you have to realize that Dr. Mitchell didn't learn about milk thistle in medical school. This was he did some independent research on his own, discovered this might be the only way he could possibly help them, gave them a high standardized grade of milk thistle, and he saved their lives. So this isn't just theoretical stuff. Milk thistle is the real deal. Other studies have shown that milk thistle supplementation can improve liver function in people with other liver diseases, suggesting it can reduce liver inflammation and liver damage. It's been shown to slightly extend life expectancy in people with alcoholic-induced liver cirrhosis. These are people with end-stage disease, and it's giving them, a few more months to years of life. It's also been shown to improve immune system function. Animal studies show quite convincingly that it actually has incredible anti-tumor effects as well, by enhancing the immune system and having some direct anti-cancer properties. So I just think milk thistle is spectacular. For individuals with more depleted glutathione status, especially in cases frequent use of the drug acetaminophen, and those with liver damage from other drugs or hepatitis C or non-alcoholic steatohepatitis or fatty liver degeneration, the use of a supplement with, N-acetylcysteine, alpha-lipoic acid, L-glutamine, and Slimming, to me makes great sense. 25% of the world's population now has non-alcoholic steatohepatitis, and that's from the obesity epidemic, plus people eating a lot of refined sugars, not exercising enough. So the carbs go to their liver, gets converted into triglycerides, and the triglycerides start to occupy the fat cell, and the fat cell storing more and more fat, or the liver cell storing more and more fat, and it starts to damage the liver cells. When that happens, liver enzymes leak into the bloodstream, and the blood levels of triglycerides is also rising. So that's how a doctor arrives at this diagnosis. You see an elevation in liver enzymes accompanied by an elevation in triglycerides. It's like, oh, this is not a good sign. So how do we reverse that? So the 2017 review article on N-acetylcysteine in the journal Cell showed that it has protective effects against liver damage from the frequent use of the drug acetaminophen, and also how it supports liver detoxification system in general. So in 2015, in the World Journal of Gastroenterology, it showed that supplementation, even with broccoli, or extracts of broccoli, could help reverse fatty liver degeneration. Also, vitamin E supplementation has been shown to reverse fatty liver degeneration. So things that can help reverse fatty liver degeneration, in addition to improving diet and improving exercise, are N-acetylcysteine, indole 3-carbinol, vitamin E supplementation, and also supplementation with trimethylglycine or betaine. But all you have to really do is give the person choline from, say, lecithin capsules. The choline from lecithin will become in the liver trimethylglycine. So it's actually a pretty simple approach that can help to repair liver damage, get the fats out of the liver cell, and allow the liver cell to repair itself. Acetaminophen use is the leading cause of death from drug-induced liver failure in this part of the world. About 50% of those deaths are suicides. The other 50% are from people just using these drugs in accordance with the recommended amount that was prescribed, up to 4,000 milligrams a day. But over time, chronic use leads to slowly depleting the body's glutathione stores. And then you start to have the intermediates of acetaminophen metabolism after phase 1 starting to damage the liver cells, as I'll show you. You can see 27 billion doses were sold back in 2009. That's when we had the last sort of update on the sales of acetaminophen-containing painkillers. So how does acetaminophen damage the liver? Well, in phase 1, the acetaminophen gets converted into this very reactive damaging compound. They just call it the NAPQI, that damages and kills liver cells. But if there's glutathione there, it can conjugate that intermediate, stabilize it so the body can convert it to a harmless substance and get it out of the body. But with chronic use of acetaminophen, it slowly depletes glutathione stores, and now the NAPQI is building up and just starting to damage liver cells every single day in the background, low-grade damage. And then over time, you start to get liver failure setting in. As I said, the antidote to acetaminophen overdose is N-acetylcysteine. Recent studies have suggested that the oral ingestion of N-acetylcysteine can help prevent liver damage from the use of acetaminophen in patients who are using it for pain control and headaches and fever. This was argued in the Journal of Drug Development Research in 2015, saying that acetaminophen-containing drugs should be combined right in the drug itself. They should combine a Tylenol-type drugs. The N-acetylcysteine should be right in the drug itself to prevent liver damage. But lawmakers and pharmaceutical companies have been very slow to react to this. So to this point in time, that hasn't happened. What they're saying is that every time you take 600 milligrams of acetaminophen, you should be taking 600 milligrams of N-acetylcysteine to raise your glutathione levels. Makes total sense to me. Some other recent studies of importance. Regular consumption of cruciferous vegetables has been shown to bolster both phase 1 and phase 2 detoxification. And we think this is one of the reasons why people that have more of these cruciferous vegetables in their diet have a lower risk across the population of breast and prostate cancer, colon cancer, other cancers. And remember that indole-3 carbinol from the cruciferous vegetables have other anti-cancer properties besides just enhancing detoxification. There's also certain flavonoids, such as those found in oranges, as we talked about, the limonene. Soy extract and soy foods contain genistein. Black tea and green tea also contain these polyphenols that are helpful. Niacin is helpful. Vitamin B2 is helpful to support phase 1 detoxification. In a 2015 review article by Hodges and followers, published in the journal Nutrition and Metabolism, the researchers concluded the following foods have demonstrated an ability to enhance the body's detoxification systems. These are foods: cruciferous vegetables, the allium vegetables, which are sort of garlic and onions, resveratrol-containing foods like grapes and grape juice, peanuts, cocoa, blueberries, bilberries, cranberries, fish oil, quercetin-containing foods like a lot of citrus fruits, but also onions and sage and tea, and also from soy products, the diadsine and genistein, lycopene-containing foods like watermelon and red bell peppers and papaya. All these, just eating these foods helps to support the body's detoxification centers. Another 2013 review paper. This is an unbelievable paper out of the Children's Hospital of Eastern Ontario Research Institute in Ottawa. It's saying, listen, this whole thing about nutrition acting as a natural chelator to get heavy metals out of the body is real. So here's what they say. This is worth spending some time on a few of these slides. In modern society, we're constantly exposed to heavy metals such as cadmium, lead, and mercury. These heavy metals have no essential biochemical role in the body, and conversely, they can cause a great deal of harm if they build up. These heavy metals bind to our tissues. They create damage, free radicals. They disrupt our endocrine systems and interfere with the absorption and function of important minerals like magnesium and zinc. Cadmium is classified as a possible carcinogen. Lead can damage the nervous system and be particularly harmful in the developing brains of young children. Mercury is also known to damage the brain and the nervous system, and there's an increasing number of people being affected by its bioaccumulation in the food chain, especially in regards to fish and seafood consumption. As such, the FDA and the Environmental Protection Agency have developed guidelines about eating fish and seafood to help reduce the risk of serious mercury accumulation in the nervous system in our bodies. Nevertheless, all of us ingest a certain amount of mercury and heavy metals that almost you can't avoid on a regular basis. The good news is that the addition In addition to working to reduce our exposure, there are some natural things we can do to help remove or detoxify and eliminate some of the heavy metals already in our body and block the absorption of some heavy metals from our intestinal tract. This is what's brilliant to me. Certain foods that are high in sulfur have been useful, as heavy metals have an affinity to bind to sulfur. Sulfur makes the heavy metal complexes more soluble and enabling the body to eliminate heavy metals more easily through the urine and the fecal route. Good sulfur-containing foods, we're back to garlic and onions, and the cruciferous vegetables, broccoli, Brussels sprouts, cabbage, cauliflower. These vegetables contain sulforaphanes and the indole-3-carbinol. Both have impressive anti-cancer properties. Garlic has prevented cadmium-induced kidney damage and decreased free radical damage due to lead in rat experiments. Fiber ingested from whole grains and fruits has reduced the levels of mercury in the brain and in the blood. Psyllium husk fiber, the active ingredient in Metamucil, but you can just buy it as a bulk product as well. Blocks the reabsorption of heavy metals back into the body once they're secreted into the gut. So it blocks the enterohepatic circulation. The reabsorption of many heavy metals is blocked by psyllium husk fiber. The ingestion of healthy minerals such as calcium, selenium, and iron at optimal nutritional levels has been shown to block the absorption of heavy metals in the body. Let's look at this. Selenium supplementation has been shown to increase mercury excretion from the body and reduce mercury-induced free radical damage in a study of 103 mercury-exposed villagers. Selenium is the way to help get the mercury out. Calcium is known to block the absorption of cadmium. It's reduced lead mobilization from the bones of women during their pregnancy and during periods of lactation. In children, nutritional iron has blunted lead accumulation. In addition, certain dietary supplements can help to detoxify heavy metals. It's well documented that glutathione helps to remove heavy metals from the body. Much of our glutathione gets used up as an antioxidant in our cells and as a conjugating agent. This often leaves insufficient amount of glutathione available to maximize its heavy metal detoxification. Sometimes you just need more glutathione. However, studies suggest that we can optimize glutathione with supplementation with the nutrients I showed you: alpha lipoic acid and acetylcysteine, L-glutamine, milk thistle. Taking glutathione in a preformed state does not work because glutathione does not get absorbed from the intestinal tract. You have to take things that allow your body to make glutathione. Taking a glutathione supplement is not going to work for you. But by boosting your glutathione, by putting those glutathione boosting agents in, you can help to raise your glutathione levels and improve your heavy metal detoxification. Also, alpha lipoic acid, in addition to boosting glutathione levels, has its own heavy metal detoxifying properties. The same is true of N-acetylcysteine. It has its own detoxifying properties for heavy metals. There are sulfur-containing amino acids that can also be helpful, which include taurine and methionine. Your body normally has ample methionine if you eat standard foods and ingest enough of the B vitamins, folic acid, and B12, as we saw earlier. You go from homocysteine to methionine. Taurine is the most abundant amino acid in the heart. To make taurine, you need vitamin B6. And it has detoxification capabilities. So with that B6 and folic acid and B12, you're helping the body make these sulfur-containing amino acids that are not only important as conjugating agents, but they also have some direct detoxification ability with heavy metals in the body. So what does a heavy metal prevention and detoxification strategy look like for most of us? First, you want to try to avoid exposure to these heavy metals, of course. With respect to detoxification of heavy metals, try to regularly consume whole grains and fruits and at least 5 servings a day, 5 servings a week of a cruciferous vegetable. Can't emphasize that enough. Add garlic and onions to your diet, possibly add psyllium husk fiber. A high potency multivitamin like the Adëeva all-in-one multivitamin is going to give you all those antioxidants, vitamin C, vitamin E, selenium, that will help to keep glutathione levels elevated. With respect to calcium, using a high potency multivitamin like the Adëeva multivitamin and making smart food choices, if you can get your calcium up to 1,000, 1,500 milligrams a day, you're helping to block the absorption of cadmium and possibly other toxic minerals. As for selenium, our multivitamin has 200 micrograms of selenium. Our multi also has folic acid, the B6, the B12. Also, taking a probiotic may also be helpful in this regard. You may want to take a glutathione booster that has the N-acetylcysteine and L-glutamine, alpha-lipoic acid, silymarin, but also sweating. If you go into a sauna and you sweat, you actually can detoxify a little bit that way. And of course, during doing endurance exercise where you're full body perspiration, it's also getting some toxins out of the body through the skin. So that shouldn't be relegated to a second-class citizen. Those things are also important. A corresponding factor is that the body's immune system is also important. As your detoxification centers become more sluggish as you get older, your immune system also weakens at the same time. So that's why I like to combine milk thistle with indole 3-carbinol with immune modulators, astragalus and reishi mushroom extract. So I did that in that product called Immuno Detox Prime that you're probably familiar with. A lot of impressive studies showing the immune modulatory effects of astragalus and reishi mushroom. Here's a couple of them here that you might want to look into. I personally, at my stage of life, take 2 Adëeva Immuno Detox Prime capsules every day. If I'm feeling a bit run down, I might take 2 capsules twice a day. Then soy isoflavones. Soy isoflavones are very important for estrogen detoxification, to clear estrogen out of the body in a timely fashion, and also to help decrease the buildup of too much estrogen in the body by blocking the aromatase enzyme and the 17-beta-hydroxysteroid dehydrogenase enzymes. And you want to try to have, especially for women, a normal estrogen to progesterone ratio to help guard against PMS, fibrocystic breast disease, uterine fibroids, and also managing menopausal symptoms. This can be helpful. But soy isoflavones also help the liver detoxify these xenoestrogens that are now present in the food, water supply that we have, as I'm going to show you. So there's a lot of these xenoestrogens that are man-made chemicals that have these estrogen mimicking effects in biological systems, including the human body. There's 28 different compounds that have been identified. They're found in skincare products and plastics, food additives, building supplies, insecticides. There's almost no way to avoid it. Plus, you have women using birth control pills and hormone replacement therapy, and then they urinate that into the water supply. So the water supply in Toronto is one thing, and then these things float downstream along the St. Lawrence River into Montreal, where you have much higher levels in the drinking water because they're getting the downstream remnants. So in Canada, the CBC had a huge report on this back in 2014, showing that prescription drugs are finding their way into human drinking water. And the immediate concern is that the fish swimming in they're swimming in a pharmaceutical soup. You're starting to see the creation of intersex fish, with males developing eggs in their testes and putting the survival of certain species in jeopardy. But also humans are ingesting this in the drinking water downstream. The other thing is that a lot of natural estrogens that are treated from livestock find their way through ground sources into the drinking water that may even be exceeding that we're getting from human birth control pills and hormone replacement therapy. So we're getting much more of these estrogen compounds that we're exposed to. So the strategies outlined previously are shown to help the body detoxify the system in a significant way, but getting more soy foods and soy isoflavones is very important, especially for women, to help keep that estrogen to progesterone balance intact. So it should be noted that both soy foods and cruciferous vegetables work together to detoxify a lot of these natural estrogens and some of these man-made estrogens, some of the pharmaceutical estrogens and the livestock estrogens. That soy foods and cruciferous vegetables, the isoflavones in soy, the indole 3-carbinol and cruciferous vegetables are helpful. So to sum all of this up, to support detoxification, there's certain dietary things that I think that you should be really educating your patients about and making it a priority. Cruciferous vegetables every day. Get them eating soy foods. Only 0.3% of the population is allergic to soy. Most people can have soy without a problem. Garlic and onions, these allium-containing foods. Green tea, black tea, resveratrol-containing foods that you see that you're familiar with. Fish and fish oil, quercetin-containing foods. lycopene-containing foods, maybe taking a probiotic, but also getting people to have probiotic-containing foods, right? Kimchi, sauerkraut, tempeh, miso, pickled turnips, non-fat yogurts, kefir, low-fat kefir. All these live bacterial cultures can be helpful. Quercetin-containing foods, a lot of fruits and onions and so on. Lycopene-containing foods, watermelon, red bell peppers, papaya, and foods that have a lot of insoluble fiber, these grains that can attach to a lot of the heavy metals and get them out of the body. Flaxseed is included, as well as psyllium husk fiber. And the more the person's eating organic foods, the better. Not everybody can afford them. I appreciate that. And try to avoid large fatty fish because of the mercury content. Doing aerobic exercise and using saunas is a great way for perspiration to get toxins out of the body. In terms of supplements, the Adëeva all-in-one multiple vitamin, I didn't really formulate it for this particular reason, but it just ties perfectly into all these strategies. As we'll talk about, it has the antioxidants, the B complex, the calcium, the iron, the selenium, the zinc, all the things that you want to do in concert to try to detoxify and block the absorption of certain heavy metals. We also make Adëeva Immunodetox Prime, especially after the age of 50, or if the liver is already being challenged by drugs or alcohol or hepatitis C or non-alcoholic steatohepatitis like fatty liver degeneration. That makes sense. The person needs extra glutathione, or even if they're just over the age of 50, as I am. I now take the ultimate GLX to get that N-acetylcysteine and alpha-lipoic acid and so on. And for women who are facing, PMS, fibrocystic breast disease, uterine fibroids, menopausal symptoms, using Adëeva's women's hormonal balance is a further consideration there. So that all-in-one multivitamin, if we just talk about the things that we looked at today, there's 1,000 milligrams of vitamin C, 400 IUs of vitamin E, 200 micrograms of selenium, 6 milligrams of iron, the B50 complex. There's the lycopene, there's the bioflavonoids, there's the beta carotene, there's the calcium, there's the molybdenum. So it has all these detoxification supporting nutrients, and some of which also help to block the absorption of heavy metals into the body. And you sort of get it all in one formulation. I'm sure you're familiar with it. Replaces the person having to buy 7 or 8 different bottles. That really, to me, is the main feature, that it's cost effective, it's practical and convenient, something people can do. This is Adëeva's Immunodetox Prime. I think after the age of 50, everyone should take it. But you see it has the milk thistle there, the standardized grade, and the indole 3-carbinol. So if they have some liver challenges or they're on a lot of prescription drugs, regardless of their age, it makes sense to give them a supplement like this. It also has the immune modulators that are helpful after the age of 50 and people who are being challenged by different types of drugs and liver disease. They're going to end up being immune compromised to some degree. So I like Immunodetox Prime. After the age of 50, I think everyone, it's just a no-brainer because your immune system and your detoxification centers slow down. This is Ultimate GLX. I take one of these a day just for general prevention. Even though I'm not on any prescription drugs, my liver is fine. I just look at all these different toxins and I think I want to keep my glutathione levels optimal. And keeping your glutathione levels at a more optimal level may help to reduce risk of Parkinson's disease. There's some evidence for that. So there's the N-acetylcysteine, there's the alpha-lipoic acid, the L-glutamine, then the standardized grade of milk thistle, because you're going to need more if you want to really support glutathione levels. So that's what that product looks like, just so you're aware of it. So I want to thank you for sitting in. The next webinar, we'll look at the other things that lead to toxins in the bloodstream, which is dysbiosis and leaky gut syndrome. So you see that the things I presented today and what I'm going to present in the next webinar sort of work together hand in glove. So stay tuned for that. I think it completes the overall picture. So I hope this was helpful to you, and I really appreciate you sitting in today. So thank you very much for attending. Of course, if you're not yet an Adëeva customer, you want to learn more about Adëeva products or order products for yourself, then basically contact Arlene Walker. You see the email there, you see her phone number. She'll explain everything to you about Adëeva's monthly specials, wholesale pricing. You can just become an affiliate where you send people to the website and get, reimbursed for that. All sort of the free educational materials that we have to help educate patients. It's all there. You can learn more at adeevainfo.com. I'll send you a copy of these slides so you can go through this presentation again, just sort of at your own pace. I had to go through quickly because there's a lot to talk about today. If you're interested in becoming a registered nutritional consultant practitioner, as I am, then there's a fast track program that practitioners can now take if they're regulated health professionals. So I would say contact Brad for more information on that. And also, when you're selling Adëeva products now, with the minimum order, you're getting the digital wellness coaching program that I created that you can give to some of your favorite patients as a nice little digital coaching tool that I think you might find quite interesting. So once again, thank you for sitting in today. I really appreciate it. I hope the subject was of interest to you. I'll send you the slides and you get a copy of the recording at some point as well. And I'm just looking in the chat box to see if there's any questions. I don't see any right now. Well, okay. Once again, I really appreciate your attention to this. I think that helping people understand that, your liver function just doesn't happen automatically without some additional nutritional support is a meaningful conversation, because if the liver starts failing and toxins build up, it spells trouble not just for the liver, but this is how mutagens get to other cells and can cause genetic damage that can lead to cancer as well, and how you get these imbalances of certain sex hormones that can make life very, very challenging for some women in particular. So thank you again.